All right. Good morning, everyone. Thank you for joining us today on this
Morning.
Wednesday morning. Um, I am Ashton Day, health educator here at the health department, and with me is my fellow health educator, Tracy.
Hi, how are you?
I'm
How's
good.
everyone doing?
We're doing great. Excited to talk about this mask ordinance. So first though, Tracy, if you want to go ahead and kind of let people know what you've been doing here at the health department since the pandemic started.
Sure. So before the pandemic started, I did HIV, STD, and hepatitis C prevention, and I still do a little bit of that work. But now it's switched over to, I'm kind of the liaison for the department for COVID research, so looking at research. I also am part of business guidance, and so I help answer emails that come in from businesses so we can keep them open and safe and provide guidance for them. And then also I assisted in helping with the efforts for the mobile COVID testing unit. So those are the things that I've been working on.
They're not busy at all, right? All right.
It's okay. It's okay. I'm happy to do it. It's humbling and a noble cause.
Yeah. So let's get into this mask ordinance. So for those that don't know, City Council did pass this ordinance Monday night. It goes into effect on Friday, July 10th at 5 p.m. And it is in effect for 90 days unless otherwise extended or rescinded or amended in any way. So for those who have to look that up like I did, that's October 8th is 90 days. So, you know, short term in the grand scheme of things, but it is for a little while this year. So let's talk a little bit about what even defines a mask. We've gotten that question a lot these last couple of days.
Okay, so just so you know, I'm opening up the ordinance just so I can be very clear. Okay, so a mask is a covering, a face mask is a covering made of cloth, fabric, or any other soft or permeable material, and without holes, that covers the nose and mouth and surrounding areas of the lower face. A covering that hides or obscures the wearer's eyes or forehead is not a face mask. And we also want to say that a mask that has a one-way valve is designed to facilitate easy exhaling, allows droplets to be released from the mask, putting others at risk. So that would not be a face mask under this ordinance. So.
Yeah, and we get into it a little bit more in detail on our FAQ. So I highly encourage everyone to go read that if you haven't already. But, you know, a mask could be like this disposable thing that I have today, or it can be a cloth mask that you make at home. You know, it can be a bandana that you roll up to have at least 2 layers to put on, or a t-shirt, a towel, really anything that you can use to kind of catch some of those droplets where the virus is transmitted through.
Right, and that is a good point, because people are asking about, you know, how to get masks or how to, and so using household things like bandanas or t-shirts or anything like that, and folding them in a way where you can put 2 hair ties on them and fold them in and then put them around is a perfect way to make a mask really easily.
Yeah, and we do have a video on our Facebook page that kind of shows that specifically for a bandana, but we also have links to the CDC website that provide step-by-step instructions for both sewing masks and for non-sewn masks as well.
Right, right.
So under this ordinance, everyone in city limits will have to wear a mask that is over the age of 10. Let me clarify that for you. And then when they're around other people who are not in their household. So we've had a few questions because, you know, Columbia, we are in the middle of a state. We have a lot of people from across the state come here to visit us. So what does this mean for someone who might live in Hallsville or Moberly or somewhere else that's not within the city limits?
So while they are in Hallsville, they do not have to wear the mask because it's not part of the city of Columbia limits. But if they live in Boone County, outside of the city limits and come into the city limits, then yes, they would be required to wear a mask, and they would, or to follow the ordinance, and that goes for anybody coming in from out of town, even out of our county. Yes.
Yes, and the ordinance does list some exemptions, and those were talked about a lot at the council meeting. So those include for people with a medical condition, a mental health condition, or disability that prevents them from wearing a mask, or for those who are hearing impaired, or people who are communicating with those who are hearing impaired. And we have had a lot of follow-up questions about how to prove that you have a medical condition. A doctor's note is not needed. You do not need to walk around with any sort of paper or anything like that that shows businesses that you may have one of those conditions, but your employer may ask you for one. We do have that in the FAQ. So be sure to talk to your supervisor in your place of work to make sure that you are following all of their guidelines when it comes to following this ordinance.
And can I state something about that too, really quick, Ashton? I wanted to state that that I feel strongly, since I work in harm reduction, that you know, shame, this comes up when talking about people who aren't wearing a mask, or people who are wearing a mask, and maybe, you know, people are either way, they're saying, why are you wearing one, or why aren't you wearing one? Shame is not a motivator. It actually, you know, we've seen it in studies in harm reduction, that it's kind of a stop. I mean, it's kind of a place where people equate shame. It feels like I am bad and I don't belong. I mean, that's kind of that, you know, that's where, and so it's a stop in conversation, and it makes people defensive. And we don't want to shame others for, you know, if they have something, if they have a medical condition, or any other reason not to wear the mask. This is more about prevention, education, you know, looking at the ordinance as something that's really protecting our community by people wearing it who may be symptomatic and not know, or I'm sorry, they're asymptomatic and not know that they are positive for COVID, or they become symptomatic, but they're out in the community a couple days before they're symptomatic and they're infectious. And so it's, you know, we just want to make sure that all people that can wear a mask, and when I say we, I don't know what just happened with the lights, but just a second. Okay. When I say we, I mean, you know, the council passed it, but I mean, I think that, you know, public health obviously supports this ordinance. So,
of course, yeah. And thank you for sharing that. I know we study a lot with harm reduction, and you know, it's great to inform people that, you know, we really are all in this together, and we're all doing the best we can navigating this right now. So in terms of the ordinance, let's talk a little bit about situations where you would wear a mask. So I kind of think of it as anytime you are for sure going to interact with people, or you think you might interact with people, you need to have that mask on. So, you know, we're talking about places like at the grocery store. You know, you might be standing in one place in the aisle and no one's around you, but very quickly, you know, a bunch of people could walk by.
That's right.
So just always being prepared in situations like that. When you're standing in lines, or you're going to have to sit close to other people, really anytime someone's within your 6-foot bubble, or could be within your 6-foot bubble, you're going to put that mask on.
Right. Exactly. Did you want me to go over some more examples, or okay. So, I mean, when you're in stands right now, we are, you know, we're starting to see people going to baseball and softball games. And so we still recommend, obviously, social distancing, staying within your own household, but still wearing that mask in the stands. And you can take it off while you're sitting, but the minute that you go to move and go somewhere else, that mask needs to come back on.
Yeah,
so
we've been talking about different sayings and things, and it's like, okay, if your seat's down, like if you're sitting, your mask can be down. If you're up, your mask is up.
That's right. I think that's the easiest way for people to remember things, that if they are sitting from a 6-foot at a 6-foot distance away from other people outside of their household, and they're sitting, the mask can come off. So that can be, you know, in a restaurant, you know, you walk in, and once you start eating and you sit down, then you can take it off. But the minute you get up to go to the bathroom, to leave, anything else, the mask, you know, comes, you know, then we put the mask back on. So yes, seat down, mask down, and stand up, mask up. Yeah, perfect.
And there are a lot of situations that are listed in the ordinance that are exemptions to the mask ordinance, and we won't necessarily go through all of those. We've kind of hit on some, but we're going to go into a little bit more detail about those specific situations that we've had questions on. So one that I've seen a lot is, do I need to wear one at the gym?
So while you are not engaging in physical activity, yes. So if you are, whether you're an employee at the desk or whether you are, walking into the gym and going into the locker room, and all of those times you should be wearing a mask. Once you begin your physical exercise, number one, you should be keeping a 6-foot distance. Then you can take it off. Yeah. But then it goes back on as you walk around an area.
Right. And same thing goes if you're exercising outdoors and you're able to keep that distance, you do not have to wear the mask. We did have someone ask about, I run or cycle on the trail. There could be people passing. Do I need to wear a mask? While we certainly recommend that you do whatever is comfortable for you, if you
Right.
feel comfortable to wear a mask, do it. But in that situation, the risk of exposure would be pretty low because they're passing you, it might only be a couple seconds that they're passing you.
That's right.
So it would not be required under the ordinance. However, we do, stress, keep that distance as much as possible if you're ever presented with a situation where you're interacting with people.
That's absolutely correct.
A lot has come up about restaurants and bars. Obviously, you can't wear a mask while you're eating.
Right.
So how do you follow that at those types of establishments?
Right. So you would walk into a restaurant or a bar with your mask and you're seated. And then once you begin drinking a beverage or eating and you're sitting at your table with your household and you are socially distanced by 6 feet from other tables, you may take your mask off and eat and drink. And then when it's time for you to get up and leave the restaurant, the mask goes back on, or if you go up to use the restroom, the mask goes back on, and you are, whether it's a restaurant or bar, and you leave. So any time that you are basically not eating and drinking, and you're staying in, when you're not eating or drinking, then you should have the mask on, and when you're sitting at the table, I just right after your meal and you're sitting within your own group, that's fine. But then I think the mask should probably go on before you leave. Yes.
Absolutely. A couple other specific situations we've gotten are if childcare providers are exempt. I know a couple people have reached out because they're working with kids. They're trying to be very expressive on their face to teach them different concepts. So what's the ruling for that?
Yeah, so my previous job years ago was a child life specialist, which is a pediatric kind of behavioral health specialist working with kids in hospital settings, helping them feel comfortable and adjusting and having less anxiety in the hospital. And I think you actually interviewed one for an earlier Facebook Live. So, the research that we do, number one, the biggest thing I would suggest is if teachers can find the clear masks, that would be great. I've seen them on Etsy. I've seen them other places. So that would be great so that children can see their lips. But we know that this is possible. In 2013 in Hong Kong, SARS was something where we know that there were teachers that wore them. And so, what I kind of have looked up, and I know from my background, is that making sure as we transition to using the masks to let children see our faces before we put them on, and so that they see that's who we are, and then put them on. And then we tell them that they can look at us with our expressions with our eyebrows or our eyes. You can also have little emotion cards like happy or sad or whatever. Teachers can even wear them like as a lanyard. And so it's almost like a good opportunity to talk about emotions more in classes. normalize emotions. So that's something, that's another idea. And then we know that kids look at facial cues. So we do know that's important. So making sure that teachers are talking about emotions, but also making sure that teachers are saying, there's nothing scary or bad. This is so that we can help keep everybody safe. It's not a costume. We want to make sure everybody stays healthy. And you know what? Their parents will probably be wearing masks out and about, obviously. And so, these are the trusted people that they know that will be wearing them. So it will become normalized for them. But yes, in the beginning, they do look at facial cues. And so doing a peekaboo with it at first during this transition, letting them know it's you. It's not a costume and you're not scary or bad. So those are just some, suggestions.
Yeah, those are some awesome suggestions. We're going to move away from specific situations and go a little bit more into the masks themselves. So I've seen a couple comments and we had some people reach out. Where can I get a mask if I do not already have one? We've already talked a little bit about making your own masks, and that is an option for everyone with household items. You have more information on that in the FAQ, and it links to the CDC.
Sure. They can, I'm sorry. Go ahead,
Oh,
Ashley.
no, go ahead. You can talk a little bit about where, if someone wanted to just go out and buy one, where they could get one.
Right. You can get one at grocery stores, retail establishments, online retailers. People are making them locally, marketplaces, Facebook marketplaces. That is an excellent way to support local business, and maybe even for people that have maybe lost their primary position and are now doing this as an extra supplement income. That is a great way to support them. But we also do have some masks here at the health department, and we've distributed them also to other places like Voluntary Action Center and the food bank. And so we supply them, just so you know, to individuals. So yeah.
Yep. And then we also, a lot of businesses in town will also be offering them to their customers in case they forget or whatever. And I think it's important to note that disposable masks are reusable. Can you talk a little bit more about how to clean those disposable masks?
Yes. So yeah, it was funny. I did listen to the council meeting, and there was somebody who was speaking, and a younger woman, and she was talking about like how having all these disposable masks and trying to be more eco-friendly, and I completely agree with her. So reusing them is okay. Instead of just making it a one shot, unless they're soiled, of course. If someone close to you sneezes or something happens, obviously we want you to throw that away. But you can spray them with a 70% alcohol solution, and then let them dry. So obviously you need more than one, but if you have 3 or 4 or 5 of those, you can spray them, let that one dry, let the one maybe from the day before dry, and once they're completely dry, then you can use them. And as far as you reuse them, and as far as a cloth mask goes, it's just a suggestion. It's the suggestion to either put them in the washing machine on warm water. You can also use a bleach solution. You're gonna have to correct me if I'm wrong, but I think it's 1/3 cup to a gallon of the solution. Soak your masks in that to water, and then soak your masks in that for about 5 minutes, and then let them dry. You can either put them in the dryer on high heat, or you can just let them air dry.
Yeah. And those cloth masks should be washed at least once a day. And so you're going to probably want a couple of them just so they have time to wash and dry and go through all that process. No matter what kind of mask you're wearing, you always want to remove it properly. So you want to remove it from the ear tube or the ties, and wash your hands before and after handling it. When you take it off, say you're at a restaurant, you need to take it off. We recommend storing it in like a reusable plastic baggie or somewhere that is clean and safe so that you can get it out again. Sorry, I'm going through.
No, that's great. I'll answer any questions.
Yeah, I'm
That's
going to
what-
check the comments real quick. There's a few we might have already touched on, but we'll do it again because I don't know what time people tuned in. So we talked a little bit about, if an employee or a customer has a medical reason to not wear a mask, do they need some sort of tag, sticker, paper, anything to let the public know they are exempt from the requirement?
No, they do not. So they do not. I think when the ordinance was written, it was the thought that may really inundate our medical system right now to have people ask for those. So really, it's just a matter of them stating that, and the businesses can accept that. And now the businesses themselves may have their own rules about who comes into their business. But as far as the ordinance goes, if someone states that they have a medical or mental condition that prevents them, or a disability, then they do not have to wear the mask. They are exempt from wearing the mask.
Right. And someone did say on here, what's to prevent a person from just saying I'm exempt? Obviously, that is not something we would encourage by any means, but I think, you especially were talking earlier about this idea of herd protection, and some experiences
Yes.
your friends and family have had because they are immune
Yes.
compromised. So I don't know if you want to share that story.
Yeah, actually, yeah. So first I'll start with herd protection. It's a word that as I was going through research, I saw in literature, and it's really just people wearing masks. So kind of like in the case of Springfield, Missouri, when there was, I think, 140 contacts, but everybody was wearing, at a hair salon, everybody was wearing masks. Including so all the customers and the stylists, and there were no positive cases that resulted from that. So that's what they would call herd protection. So that's really what this ordinance is trying to encourage and promote. But yes, so on a personal note, I have a friend, a lifelong best friend, who is currently under treatment for cancer. And so she looks at this with different eyes than I do. And so as she is, at first, when we put on the mask, sometimes we think we're kind of protecting ourselves and certainly protecting other people. When you're a vulnerable person and you're looking out and you're out because you have to do some things, you can't have everything delivered to your house. You see everybody as someone that could potentially, be having the virus, having the droplets go into the air close to you. And it's very frightening for her, and it makes her feel like she has to stay home. And I just don't think that's the position that I know our community wants to take, is having all people who are vulnerable just stay home. They will limit their activity, they will, but just the thought of them staying home for the next year is just not, that's not kindness. That's not from a place of kindness. And so that really got to me when I thought about viewing it through her eyes, that wearing it was really a respect to her and her vulnerabilities, because it's protecting her. So that was something. I have had two people in my family, two family members, close family members, who have recovered from COVID. And one was, younger. I won't say who they are because I haven't asked permission, but one was younger. And so, he hasn't had any lingering, effects from it, but certainly it was not pleasant while he had it. But I have another family member who, still is fatigued, still coughs every once in a while. And this was a diagnosis made back in March. Beginning of April. And so there's still some lingering effects for her. And there's also some, I'm not going to call it PTSD or anything, but she still has this feeling at night, like, am I going to, wake up and not breathe? Because while she was under isolation, she kept her bathroom light on and the hall light on, so that her son, who was there to help take care of her, would have lights on in case she would stop breathing and have to call 911. And so she keeps remembering that, and it is it's something that can stay with people for a while. This is not the same as the flu. I mean, this is something that's very different respiratory wise, that is really scary to people who wind up with moderate to severe effects of the illness.
Yeah, well, thank you for sharing that story. I know we're wanting to share more information about those who might have recovered or experienced COVID. So hopefully we can do that more in the future. For masks, let's talk a little bit. There's a question here that kind of relates to what we've talked about. So do you still have to social distance when you wear a mask?
Oh, absolutely. Yes. So the mask is really just another extra layer of protection. Social distancing is still one of the best tools in the toolbox. We're just adding to the toolbox. So social distancing keeps the droplets away from people who you are interacting with, and then the mask keeps the droplets from actually leaving your face. So it's stopping spit coming out when you're talking, or if you do sneeze, it stops a sneeze. If you are yelling or kind of emitting more, or singing or emitting more, then having that will stop the droplets.
Right. And I think it's important to note too, even if you are wearing a mask with someone close to someone and they ended up testing positive and you were around them when they were infectious, you will still have to quarantine for 14 days, even though you had the mask, because unfortunately right now we don't have anything that's 100% foolproof, from COVID. We're still learning more about it. However, it's important to remember that mask prevents a lot. It lowers the exposure a lot. It prevents you from getting infected from that person. So while you will quarantine to be safe and make sure you are not exposing anybody else, it lowers your chance of actually becoming infectious.
And yeah, I wanted to expand on that a little bit. So, let's say that, I'm here at work today. I'm not wearing my mask because I'm in a closed room, well beyond 6 feet from everybody. I'm in an exam room right now. But if someone, if I were to find out, like in 3 days, that I start getting symptoms and get tested and I'm positive, but I've been wearing that mask the whole time, that will also make me feel better that I've tried to protect as many people as I've come in contact with. Even if I've kept a 6-foot distance from them, I've done everything I can. I think sometimes people, when they're tested positive, there is a stigma with some of this, and we don't want a stigma with COVID. We do not want that, but we do want people to have the knowledge and the informed knowledge that if they can put it on after, if they are tested positive, they can say, okay, I had my mask on, so I protected my family, my coworkers, my friends as best as I could, before I found out. And so it's kind of a prevention for people not feeling bad or whatever, so that, I think that's the way to kind of look at it too, is, through the contact tracing part and the, trying to figure out how people will feel if they are tested positive. They'll feel better that they wore the mask so that they protected all the loved ones around them.
Right. That's a great point. We're going to answer a few more specific questions from the comments. So what about kids in day camps where they are inside a gym or building with many kids not related and can't social distance?
So children do not have to wear them. Children 10 and older are required to wear the face mask. So they do not have to wear the face mask if they are younger than 10. So it depends on how old they are. If they are, if they're younger than that, they're staying in stable groups, and so they are not required to wear the mask. It may be that they want to. They're if they can keep it on, and they they understand how to wear it, how to take it off, and how not to touch their face. That can be a family decision. But as far as the ordinance goes, it's 10 and older. And because kids are staying in stable groups, they'll wind up being close contacts if someone's positive in that. And so, that's how it will be figured out, as far as if someone tests positive within that stable group, they will, either many of them or all of them will have to quarantine, depending upon the situation and investigation.
Yeah, and I'm glad you brought up that stable group, because we have had a few questions of if this ordinance supersedes the public health order. It does not. This works in conjunction with it. So, those personal care services like your nail salons, hair salons, massages, they have already been required to wear the masks, the service providers and the clients, and they will continue doing that, along with the specific occupancy limits, the social distancing, and other situations, all of that, just like everyone else will too. So these work together. It does not mean that the order is done.
Right.
Let's talk a little bit about face shields. So I know you've done a lot of research on this. So under the ordinance, face shields are not approved. They're not considered a mask under the definition, and the CDC does not recommend using face shields as an alternative to cloth masks. What have you found is the reasoning for that?
Because the droplets can go out underneath and to the side. They are a great protection with the mask, though. So because they protect the eyes, they protect the face. So, we have given guidance to people who are in situations where, if they are in front of singers, if they are in front of anyone super emitting droplets, because when you sing and you yell, you wind up, or I should say give instruction, not yell, if you have to do it loudly. If you're in front of that, then, it can protect your eyes, it can protect your face. So they absolutely are a great complement to them, but it is not, it's not fitted underneath. So if you think about it, if someone's in a salon and they are cutting your hair, this is just an example, they're breathing and, they're breathing under, and then breathing right under you. So, or over you if you're sitting. So that's why they're not, but they're a complement. Like I think if they're something that you find appropriate and you want to protect your eyes and your nose from droplets, I think that is great.
Yeah.
But they're not, but they don't replace the mask.
Right. And if CDC guidance changes on that, we will update.
Absolutely. Absolutely. And if it does, then yes, then we will look at that and do however we need to do the ordinance to make sure that all updated guidance that we get will be reflected. Yeah.
There was an exemption discussed at the council meeting that ended up making it into the ordinance that someone just asked about. So state employees, like in state buildings, like the University of Missouri, federal buildings, even Boone County buildings, they are exempted from this order. What that means is the building itself and that property, because it's not owned by the city of Columbia,
Right.
we can't instill
like jurisdiction.
That's the word I was looking for. So like University of Missouri specifically, that is state owned. They're a branch of the state, so they follow state rules. However, I will say, I think as of right now, they plan on having their students wear masks when they are in class and any building that they might interact with people. I believe I heard the hospital has also updated their mask ordinance. So anytime you are visiting a facility that's university owned, state owned, federal owned, all of that, I would just keep up with whatever policies they have in place at the time, because they could adopt a similar policy based on what's already in ordinance in the city. Let's talk about employers. So we work closely with businesses all the time and try to do our best to provide them the latest guidance throughout this whole thing. But in the ordinance, it does say they have to provide masks, clean masks to their employees. So where can they get these masks?
So on the FAQ, there is a PPP market or a PPE marketplace where they can go through the state and try to get some. If I know there might be a small lag, I'm not sure about that, but obviously they can get them at all of the same places that we mentioned before: retail shops, local people who are making them, buying bandanas and hair ties, and buying at least 2 or 3 so that they can be washed in between. And so, yeah, we want to make sure that we know that this is obviously an expense for businesses, and they do not need to have any kind of special masks or anything for their employees. But it's a good opportunity for them if they did want to order anything and put their logo or their branding or anything on it, so people could walk around with it. That'd be awesome.
Yeah.
So
we've had some businesses reach out to you and just kind of want clarification on how they inform their customers of the ordinance and how to keep their employees safe as well.
Right.
Right. Sorry, go ahead.
Oh no. So yeah, so we have made signage. One of our other health educators, Sarah, has made these awesome graphics for us. And so we have signage and many different kinds. So they're humor, they're different. So there's not just one. You can kind of pick whatever is best for your business if you'd like to hang that up. But so yes, for businesses, hanging up the sign, asking people to put one on, providing them if you want. We don't require you to provide them for your customers, but providing them if you want, it are good ways. And so, what we are looking for from businesses is that they are just following the ordinance and making sure that they're promoting the mask wearing, but they should not, if someone says, I have a medical condition, then we know that that's an exception. And then, they do not walk in with the mask according to the ordinance. Again, if their business has a different set of guidelines, that is completely up to the business.
Yes, businesses always have the right to make whatever rules when it comes to service. They can decide if they provide service or not to individuals. And then we do have it that was discussed at the council meeting, and it is an FAQ. If for whatever reason a business owner is experiencing a customer who is causing immediate danger to others within the building, they are able to call 911 and ask for police assistance in that situation.
Yes. And that's kind of why in the beginning, I know it might have been a weird connection, but I was talking about shame. I mean, because I do think I think we've all seen, on our computers, our phones, our TVs, people who, are having a difficult time, and whether it's because they don't want to wear it or because they have an exemption, we don't want things to escalate. We don't want to use shame. We don't want things to escalate. We want to keep our employees of our local businesses safe too. So if the employer and the employees do their due diligence in hanging up signs and absolutely asking every customer to please put one on, or providing them if they choose, for customers that don't have one, they're doing their due diligence. And if someone says, I have an exception, or exemption, I should say, then that's what then they accept that. And yes, people may come and get around the system. I hope that doesn't happen, because I believe in our, humanity. I believe in the kindness of our community. I believe so many people are doing everything that they can to be safe. So, I have full faith that there'll be less people doing that than most people will be wanting to keep our community safe and healthy and protect them in case, wearing the mask in case they wind up being testing positive, a few days later.
we did just get a question. Do you know if the Columbia Public Schools will be looking at changing their decision about the kids under 10 wearing a mask at school? I think right now they're requiring the kids to wear them in school, like all ages. Yeah, we are working closely with CPS for all of their returning to school guidelines. That would be their decision. They have to follow the ordinance for the over 10 because they are in city limits, but anything beyond that they choose to do is their choice. And I'm sure they will notify the public and parents and students once they decide.
Yes.
Let's talk a little bit about enforcement, because that's been a question for people. I mean, we are both health educators. We lead with education with everything that we do here at PHHS. And so we will say that this ordinance is complaint driven. So just like the stay-at-home order, you can call that same number, that 573-874-CITY, or email city@como.gov, that to file your complaint. We will reach out to that establishment or entity, whatever it may be, and just kind of figure out what's going on. Like, hey, we heard you had 70 people in here not wearing masks or something, like whatever the complaint may be. So we will reach out, educate, make sure things are, just make sure everything's being followed in the best way that it can. We do work with the Office of Neighborhood Services on that. So the ONS might be the ones coming knocking on your business door, but it's really to educate first. In instances where there is repeat offenses, or it becomes an issue that it's clearly, it's not a medical condition, it's just the establishment or the entity not enforcing the ordinance. In that case, the citation would be served just like a ticket, because it is civil, and then you would have to go to court for that situation.
That's correct. Yes.
Yeah. Obviously, we hope we never have to get to that point, but I think a lot of people have been concerned about it, so just wanted to clear that.
I hope not either. I mean, even when we are looking at some of the follow-up that we do for other things, you're right, Ashton, we call, we talk to them about or see them, whatever the case may be, educate, give them our guidance book. I want to say this is novel and new for everybody. It's a learning curve for everybody. We do not in public health make the assumption that everybody's just doing the wrong thing and everybody needs like a citation. Like that is not our mindset. Our mindset is this is new and novel, and people are trying to wrap their heads around it, while quite frankly being very worried or anxious if other things are going on, like job loss or anxiety and other things. And so we realize that this is something that we're not coming from a place of wanting to be punitive. We're coming from a place of we are trying to figure out a whole different mindset of how to live our lives and how to right now, while the virus is infectious and we don't have a vaccine or anything or treatment. Well, I mean, I guess that's a cure. Yeah. So saying that, we want to come from a place of, what we need to, looking at our research, we just want to help you figure out in your particular business, how can you integrate all of these things that we are putting out. And then, but yes, if we see an egregious, just, blatant, not even paying attention to the ordinance, and we've educated, then that just gives us a tool to say, hey, you're not serving our community by doing this. You're not protecting our community. You're not being a good steward to the community. And so that's, we are absolutely coming from a place where we believe that people are still trying to wrap their heads around how they negotiate in this world when we've got a novel virus, again, that I want to state that is not like the flu. The flu does not jam up every ICU, and not obviously not, here, but in larger metro areas, we haven't seen that with the flu. It doesn't jam up every ICU everywhere. And so this is different. And I do realize that 80% of the people don't have that, but we need to protect the people that may have to go in. And we also need to protect our first responders and our healthcare workers that come upon people who are positive for COVID. So, that's why the mask ordinance is in place, just to really, really help just again, another tool in the toolbox to slow the spread. And also for those that aren't patroning businesses because there's not a mask ordinance or people aren't wearing them as often, hopefully it will help, businesses also, see more people coming in because people feel protected if they're vulnerable, or they feel like they don't feel as safe if people aren't wearing them around them. So hopefully that will help.
We do have a business owner here who is asking about what happens if an employee chooses to not wear a mask because of personal reasons. I will just say that is not exempt in the ordinance. You have to have a medical condition or mental health condition or one of those. Oh,
or a disability. I know. We have eco lights here in the health department, so they go off if we don't move enough.
Yeah. But those things are not exempt. And he did say something about protection for the employer. That would have to be a city question. Unfortunately, we are answering the health related questions. I don't want to speak to something that I don't have knowledge in, but you can email that to city@como.gov and they will get back to you as soon as possible with that answer. We just have time for a few more questions. And I will say too, we will go back through the comments and write responses to everybody too, as soon as we can. So you don't have to scroll through the whole live to find your answer. This question, so why not kids under 10? What went into that decision in terms of the ordinance for not having kids under 10 wear the masks? I know we have certain protections for stable groups, and that is specifically for contact tracing and lowering the exposure for kids. But what went into that decision? Do you know?
Well, I didn't write the ordinance, so I don't. But what I will say, just from my child development background, I think that was just an age that was picked based on the fact that they can developmentally really understand the rules of taking it off safely, washing your hands, after taking it off, putting it on, and that they're able to realize that they shouldn't be touching their face while their mask is on and pulling at their mask. I think it was probably based on developmental, what stage children are in developmentally, where they're beginning to really understand more abstract thinking about what is going on, in the world, and why the mask is important, and how to make sure that they're using it and being compliant with it and being safe. That is not to say that a 5-year-old couldn't safely wear a mask, but I think that that was the reason why, was that was probably just a good developmental age where the compliance would be high.
Right. And even though the ordinance says age 10, the CDC does say anyone over the age of 2 is recommended. And, while we are still learning a lot about COVID and how it may affect children, you can see on our dashboard, we have had kids in our community under the age of 15 be infected. So there's always a risk for everyone, no matter your age. So we definitely still recommend it for under 10 if they can safely do it and take it on and off themselves.
Absolutely. Yeah.
Is there anything that you would like to end on that I haven't touched on that you
I don't know. I really I feel like you have touched on everything. I just feel like at the end of the day, this mask ordinance, obviously, I do know that it was something that people feel strongly about one way or the other. And, I just want to drive home the message about making this something that is not based on shaming people either way, that I think we will grow as we will create a habit with this over the next 90 days. And we will grow in our habit, and we will understand, I think, the effects of it more in 90 days, like how much it's preventing. It's really hard in public health. We do prevention, we do evidence-based prevention, but we don't always see, our outcome, because we inspect, I'm kind of getting off on a tangent, but we inspect food and restaurants. So we don't, we don't see all of the things that could happen because we prevent them, same with all of our other units here at the health department. We try to prevent things from happening. So we don't really see, it's hard to see the effects. And so hopefully with the masks, we'll be able to see the climbing numbers, which Ashton, you've done an amazing job with your graphics of showing just how quickly this is climbing, how many cases we're getting every day, and how quickly they're coming in. We will be able to see how much this is helping, how much this ordinance will be helping, and then continue to change, any kind of recommendation or any kind of any kind of guidance we're going to put out based on new research, updated research. This is so new. We don't have any longitudinal studies. The CDC finally was able to get some from Asia and from Europe, and that's why they, their guidance, switched to recommending it for everyone. Well, not everyone, without the exception, over 2 or under 2 and all that. But this is with a novel virus. We're all in a situation where we're constantly evolving and learning, and so that can become very, very confusing for people. And we are trying to do our best with every time something new comes out, informing everyone and letting them know it's changed. I mean, usually when you think of things like, measles or mumps or things like that have been around for a long time, we have studies and people know about it. And so we're not living through the research project, the process. We are now. And so I can understand why people, are kind of all over the map about how they feel about things, because we're living in real time with the science coming in at real time. And that's a really difficult place for people to be and take in. And so I would just say that have patience with, with everyone around you. Everyone is learning and adjusting and dealing with other things outside of COVID. And that, we're a kind community. We are a compassionate community. And I feel like, the most compassionate thing you can do, if you are able, is to wear a mask for those who, we don't want to pass on COVID to someone else. So that's how I'll end. No shaming, just education, and just, doing it because it's the thing to do for people who are more vulnerable, and letting them go outside of their house, more than they're able to probably right now if they don't feel as safe. That's it.
I just love
and
that.
thank you for everyone who is doing everything. So Ashton knows I'm a talker. So just when you think I'm done, I'll add more. No, but I want to thank everybody for everything that they're doing. And even, I will say this, even people that opposed this ordinance, I want to say they've been looking at things and doing research, and their drive to understand this is very that's understandable to me, because this is a virus that we have no control over right now. And so trying to find some semblance of control during this time is very understandable. But it did pass, and so here we are, and we're doing the Facebook Live and explaining it.
Yeah. Thank you so much for joining us today, Tracy, and thank you for all your work you do here. Everyone on health promotion, everyone in the—
There we go. I need to move, okay?
Thank you so much. I will just reiterate for everyone watching as we end this, the ordinance does go into effect on Friday, July 10th at 5 p.m. It will be in effect for 90 days unless otherwise extended, rescinded, amended, all of that. Tracy touched on this too. We'll see the effects of this later on to make sure this masking is working. I will say, because of the timeline of when this masking ordinance starts, in conjunction with the holiday weekend we just had, it may be a couple incubation periods before we
That's
see
right.
the true effects of
Yes.
masking. And I just want to throw that out there because we have seen increase in cases after every holiday weekend we've had in the last couple months. So just keep that in mind. But we will always, share the new cases. If there are any events or gatherings we think they might be related to that the public needs to know about, we will share that information. Lastly, if there are any other questions you may have about the ordinance, please message us on Facebook. I will go back through and try to write replies to all of the comments that we've had on this post and the post we had yesterday announcing this live. And then always too, if you want to email at coronavirus@como.gov, that might get you a more direct response, but that can be masking, that can be contact tracing, that can be any question you may have about COVID. We will answer on that email. I think that's it. Thank you so much for joining us today.
You're welcome. You're welcome. So I'm happy to be doing this again. Working in public health is a noble and humbling and wonderful, it's a humbling work, and we love what we do. And we are in a position where I think that some people, it's hard, to go from, like myself, sometimes from like a medical background where you're just working with individuals to thinking about the public in general. And so, trying to figure out what is healthiest for our whole community is what we do. And then obviously people go to their providers for their own individual health, but we're trying to look at the holistic health of people's, mental health, physical health, social or spiritual health, sexual health, all of that. And so, we come from a place of just wanting to make sure that everyone is protected.
Absolutely. All right. Yeah. Thank you so much. And thanks for joining us today, everyone. And we will see you next time.
Bye. Thank you. Bye-bye.